Good afternoon, today is May 9th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that 1.4 million health jobs have been lost during this huge health crisis of the pandemic. And this is just quite surprising because right now we see the hospitals being overwhelmed, yet still doctors and nurses have been laid off. So the first reason why this may be occurring is that elective surgeries or non-COVID-19 surgeries have been stopped by the federal government in fear of spreading infections throughout the hospital. And so as a result, hospitals are not making as much money as they were before, and this leads to them having to cut the salaries or lay off doctors and workers. The second reason why this may be happening is that in this pandemic and the economic crisis, many people have lost their jobs. So when they have lost their jobs, they obviously lose income, and many people don't have enough money to go and seek healthcare. And obviously, Americans' healthcare system is extremely expensive, so obviously, if they do not have money or income, then obviously they would just choose not to go to the hospitals instead. And I think it really shows how the American healthcare system is seriously damaged. And I hope after this pandemic we can fix the healthcare system so that it can benefit more people and having more people go to the hospital to seek treatment. The second thing that I like to talk about is that the first antigen tests have been approved by the FDA for emergency use authorization. This antigen test is by the Quiddle Corporation of San Diego, and it works by detecting fragments of the virus in a sample. So the first benefit of this is that they can be processed extremely quickly and in a matter of minutes, and they can also process millions of tests a day because it has a much more rapid turnaround. The second benefit is that it is extremely accurate in testing positive infections. However, they cannot detect all active infections, and the downside of this test is that it has a higher chance of false negatives than regular tests. However, false positives is preferable to false negatives because infected people given a negative result could unknowingly spread the virus to others. So that is just a flaw in this test. However, it has the ability to test up to millions of tests a day, and so even though they may give more false negatives, they're still more preferable. The third thing that I like to talk about is that patients with mild to moderate COVID-19 appear to improve more quickly if they were treated with a 3-drug cocktail, basically. So, in a new study published in The Lancet, researchers at 6 public health hospitals in Hong Kong and the University of Hong Kong followed 127 adults with COVID-19, including 86 on the 3-drug cocktail and 41 in a comparison group. This was in the preliminary phase 2 trial intended to see if a treatment works, and the result was that they were tested negative for the coronavirus within 7 days, and on average compared to with an average of 12 days among the treated with only 1 drug. And this is obviously good news because it tells us that patients get better faster, and the time they need to be hospitalized is shorter. So, but however, while all the patients in the study had mild to moderate disease, the important question is whether the drug combination would benefit critically ill patients. And this 3-drug, triple drug treatment appeared to be safe, so that there was no difference in the 2 groups in side effects. So I think this is a really good idea that we can perform. So the 3 drugs included were 3 antiviral drugs. The first one being lopinavir, ritonavir, taken orally. Ribavirin, an antiviral drug used to treat hepatitis C, also taken orally. And interferon beta 1b, an injectable drug used to treat multiple sclerosis that regulates inflammation and suppresses viral growth. So this may boost the body's ability to fight the new coronavirus. And so this is things of like new ways and treatments that are developed by doctors and scientists worldwide that can actually have shown to be proved effective. That's it. Thank you for listening, and have a good day. Thank you.